Certified Patient Care Technician. Significant points. Some patient care technicians are trained on the job, but many complete a minimum of 200 hours of instruction in schools, community, or junior colleges. Job prospects should be best for patient care technicians with formal training or experience, particularly those with certification. Nature of the work. Patient care technicians, also known as nursing assistants, geriatric aides, unlicensed assistive personnel, or hospital attendants, perform routine tasks under the supervision of nursing and medical staff. They answer patients' call lights, deliver messages, serve meals, make beds, and help patients eat, dress, and bathe. Aides also may provide skin care to patients, take their temperatures, pulse rate, respiration rate, and blood pressure, and help patients get in and out of bed and walk. They also may escort patients to operating and examining rooms, keep patients' rooms neat, set up equipment, store and move supplies, or assist with some procedures. Aides observe patients' physical, mental, and emotional conditions and report any change to the nursing or medical staff. Nursing and psychiatric aides help care for physically or mentally ill, injured, disabled, or infirm individuals confined to hospitals, nursing care facilities, and mental health settings. Home health aides' duties are similar, but they work in patients' homes or residential care facilities. Home health aides help elderly, convalescent, or disabled persons live in their own homes instead of in a health facility. Under the direction of nursing or medical staff, they provide health-related services, such as administering oral medications. Personal and home care aides are individuals who provide mainly housekeeping and routine personal care services. Like nursing aides, home health aides may check patients' pulse rates, temperatures, and respiration rates, help with simple prescribed exercises, keep patients' rooms neat, and help patients move from bed, bathe, dress, and groom. Occasionally, they change non-sterile dressings, give massages and alcohol rubs, or assist with braces and artificial limbs. Experienced home health aides also may assist with medical equipment, such as ventilators, which helps patients breathe. When preparing for the National Certifying Exam for Patient Care Technicians, I would highly recommend my book, Patient Care Technician Certification Exam Review Questions. It's available on bestamericanhealthed.com/resources.html. Some states would allow patient care technicians to work as home health aides, while some states, like California, would require specific certification as a home health aide. Check your state's policies. Working conditions. Most full-time patient care technicians work about 40 hours a week. However, since some patients need care 24 hours a day, some PCTs work evenings, nights, weekends, and holidays. Many work part-time. PCTs spend many hours standing and walking, and they often face heavy workloads because they may have to move patients in and out of bed or help them stand or walk. Aides must guard against back injury. PCTs also may face hazards from minor infections and major diseases, such as hepatitis, but can avoid infections by following proper procedures. PCTs often have unpleasant duties, such as emptying bedpans and changing soiled bed liners. Some patients they care for may be disoriented, irritable, or uncooperative. While their work can be emotionally demanding, many PCTs gain satisfaction from assisting those in need. Employment. Some employers provide classroom instructions for newly hired PCTs, while others rely exclusively on informal, on-the-job instruction from a licensed nurse or an experienced tech. Such training may last several days to a few months. From time to time, PCTs also may attend lectures, workshops, and in-service training. These occupations can offer individuals an entry into the world of work. The flexibility of night and weekend hours also provide high school and college students a chance to work during the school year. Applicants should be tactful, patient, understanding, emotionally stable and dependable, and should have a desire to help people. They also should be able to work as part of a team, have good communication skills, and be willing to perform repetitive routine tasks. PCTs must be in good health, A physical examination including state-regulated tests, such as those for tuberculosis, may be required. Job outlook. Numerous job openings for patient care technicians will arise from a combination of fast employment growth and high replacement needs. High replacement needs in this large occupation reflect modest entry requirements, low pay, high physical and emotional demands, and lack of opportunities for advancement. For these same reasons, many people are unwilling to perform the kind of work required by the occupation. Therefore, persons who are interested in and suited for this work should have excellent job opportunities. Overall employment of patient care technicians is projected to grow for all occupations through the year 2020, although individual occupational growth rates will vary. Employment of PCTs is expected to grow the fastest as a result of both growing demand for home healthcare services from an aging population and efforts to contain healthcare costs by moving patients out of hospitals and nursing care facilities as quickly as possible. Consumer preference for care in the home and improvements in medical technologies for in-home treatment also will contribute to faster than average employment growth for PCTs. Description. This program will prepare the student for an entry-level position as a patient care technician. Emphasis is on technical skills necessary to perform personal care to complex patients, implementation of selected portions of care plans, including respiratory services, rehabilitation services, EKG and phlebotomy under the supervision of registered nurses. This is a competency-based curriculum. Therefore, there are institutional differences on the minimum hours. The recommended minimum is 200 hours. The curriculum for the patient care technician usually includes Introduction to Patient Care. Students learn to perform a variety of acute care skills related to the hospital setting, the needs of adult patients with specific health problems such as diabetes, arthritis, spinal cord injuries, and seizure disorders, among others, are discussed. Psychological aspects of patient care. This course provides the student with skills important to effective communication as it relates to patient care. Emphasis is placed on the effective verbal, nonverbal, written communication skills. Leadership, teamwork strategies for relating to patients and families should be emphasized. Medical anatomy and physiology. This course is a study of human anatomy and physiology. Lectures systematically take the student from the microscopic level through the formation of organ systems, with emphasis on the interdependence of these systems. Functional concepts and internal structures are related to surface anatomy as a basis for performing a physical examination. The physiology lectures will provide the overall physiology of the human body, but will also relate how that physiology breaks down or malfunctions in time of infection, disease, trauma, and aging. Medical terminology. This course is a study of a medical vocabulary system. It includes structure, recognition, analysis, definition, spelling, pronunciation, and combination of medical terms from prefixes, suffixes, roots, and combining forms. Medical law and ethics. This is a course of instruction in principles, procedures, and regulations involving legal and ethical relationships among physicians, patients, and medical assistants. It includes current ethical issues as they relate to the practice of medicine and conformity responsibilities. This is a writing-intensive course. Asepsis and infection control. This course is a study of a standard protocol for the protection of the healthcare worker and patient to ensure that the procedures and treatments prescribed by the physician are performed properly and safely to assist in the patient's return to health. CPR and first aid. This course will cover the theory and practical skills of the standard first aid course prescribed by the American Red Cross, American Heart Association, or other national certification bodies. The focus of this course will provide a general understanding of the needs of the injured person, and in doing so, give care to the person conducting CPR until medical help is obtained. Ambulatory. This course is a study that focuses on clinical skills performed by the patient care technician in the back office of a general medical practice. Students will learn about the concepts of professionalism, communication and triage, patient history, physical assessment, equipment and diagnostic procedures used during the examination to assist the healthcare provider with diagnosis, and performing appropriate charting for medical record documentation. Basic nursing assistant and geriatric patient care. A variety of nursing assistant skills are provided. The student learns to perform basic nursing procedures, caring for the patient's emotional and physical needs. Principles of universal precautions, isolation, and infection control are included. Geriatric care is emphasized together with restorative care and patient care plans. Home health care. Students are introduced into the roles and responsibilities of the home health aide. Topics include legal and ethical responsibilities, patient safety and physical comfort, nutrition, infection control, and communication. Students also learn to follow work plans with the patient and family. Applied health applications. Students perform diverse patient care skills involving allied health modalities within their scope of practice of unlicensed assistive personnel. Basic respiratory care modalities are introduced. Students also learn to perform colostomy care, skin and decubitus care, removal and care of peripheral intravenous catheters, as well as assisting with orthopedic devices. Introduction to EKG. This course introduces students to patient preparation, EKG machines, performing and mounting of 12-lead, single-channel EKG tracings, review of the cardiovascular system and related terminology, emphasis on the basic rhythm identification and possible disease states. Applied EKG. Advanced knowledge of the cardiovascular system with emphasis on the heart in disease states includes identification of cardiac arrhythmias using EKG waveform, interpretation of advanced arrhythmias, hypertrophies, cardiac ischemia, and myocardial infarction is discussed. Clinical EKG. This course provides advanced training, which is often required to obtain employment in the field. Cardiac stress test, artificial pacemaker evaluation, 24-hour Holter monitoring, and advanced cardiac arrhythmia recognition and telemetry monitoring. Students use equipment which includes the pacemaker simulator, Holter monitor recorders, 3-channel EKG technician systems, and telemetry monitors. Introduction to Phlebotomy. Introduction course that explains the function of today's phlebotomy technicians, such as collective procedures, therapeutic phlebotomy, and laboratory testing. Hematology. This is a basic hematology course that studies the cell of the blood. Time is spent learning the technique to enumerate blood cells, understanding the function of each cell, and to learn the disease or continue that would result in abnormalities in the laboratory test performed. Techniques in making and staining a blood smear, along with evaluation and differentiating a blood cell through microscopic examination, proper methods of police collection, and processing are taught as practice. Applied venipuncture. This course is designed to instruct the student in the proper method of both capillary and venous blood collection. Equipment, legal issues, and specimen transport are taught and practiced. Clinical phlebotomy. Clinical phlebotomy expands the skills and experiences at a clinic and/or hospital setting under the direct supervision of a medical laboratory technician or technologist. The student will comprehend and follow procedural guidelines for laboratory testing, including specimen collection, specimen processing, result reporting, and record documentation, quality assurance monitoring in the collection of blood, complying with safety requirements, and professionalism with patients, co-workers, and healthcare professionals are also emphasized. Hipaa Compliance. This is a short course of study that discusses the patient's rights to privacy, the laws and regulations of the Health Insurance Portability and Accountability Act, Hipaa, the governing bodies that set the standards and penalties provided for noncompliance are also discussed. Externship. Students are placed in a medical facility where there is an opportunity to observe, assist, learn, and perform patient services in an acute care setting. The externship is an essential component of the program, where theoretical and practical skills are integrated. Specific instructions, including cognitive, affective, and psychomotor behaviors, must be met for students to complete this course. Career development. This course is designed to assist the student in resume development, soft skills, interviewing strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for real-life experience. At the end of this course module, the student should list the composition of cells, tissues, organs, and systems. Describe the correlation between cells and systems. Identify the organs with each system and their function. Identify and utilize the correct root word for each organ. Explain the importance of controlling the spread of infectious organisms. Identify the meaning of infection, microorganism, and pathogen. List the chain of infections. Explain the universal precautions. Identify the proper hand-washing techniques as the most important step in infection control. Differentiate isolation techniques and the purpose of their use. List the equipment needed to perform a phlebotomy procedure. Use proper venipuncture cleansing technique. Use a tourniquet and explain the purpose of its use. Differentiate the two methods of draw. List the order of draw for each method. Identify the different needles used in phlebotomy. Understand the differences in the needle gauges. Use the proper needle gauge and type for the procedure. Differentiate the different colored tubes used in phlebotomy. Explain the purpose of the additives to the tubes. Identify the test which can be taken in the presence of such additives. Determine which colored tubes to use for the test ordered. Identify the various special testing the technician may perform. Explain why these tests are important in the diagnosing of disease. Identify normal ranges and abnormal ranges. Perform the various tests and related procedures. Recognize phlebotomy-related complications. Identify possible life-threatening complications. Act upon the specific complication. Properly notify nursing personnel regarding such complication. Discuss the various departments within the laboratory. Explain the laboratory hierarchy and the different personnel types and job-related duties. Identify the collection schemes with the healthcare settings. Differentiate the duties of the PCT within a blood collection bank. Utilize the phlebotomy equipment, ensuring patient safety and employee safety. Follow infection control procedures. Observe universal precaution. Obtain blood from the mannequin. Perform all of these tests utilizing proper techniques. List the procedure for electrocardiography. Define electrodes, electrocardiograph, electrocardiography, electrolyte gel. Properly place the electrodes. Perform a 12-lead EKG. Connect Holter monitors. Perform stress tests. Understand angiocardiographic studies. Cardiac catheterization. Use the proper medical terminology associated with EKG testing. List the characteristics needed to be a successful member of the healthcare team. List the duties of a patient care associate, technician. Explain how interpersonal relations influence the well-being of the patient. Explain how interpersonal relations influence the well-being of the patient. Demonstrate professional attitude. List ergonomic techniques which can help prevent accidents. Develop the correct use of body mechanics. Use equipment safely. Describe the proper use of oxygen and related safety. Identify proper fire safety techniques. Follow proper evacuation procedure guidelines. List general measures to take in the event of an emergency. Recognize the emergency situation. Explain the purpose of the patient's Bill of Rights. Follow the rule of personal liability. Discuss and interpret informed consent. Observe DNR orders. Describe the legislatives involved in the patient medical record. Observe patient confidentiality. Describe the laws pertaining to medicine. Discuss quality assurance procedures. Communicate with the patient family member and staff. Include the communication process. Be aware of the body language being used. Discuss the proper tone to use when communicating in different scenarios. Record proper phone messages. Make subjective, objective observations. The students will demonstrate an understanding of the theory of the patient care technician by scoring a minimum of 70% on the National Certification Written Exam.